I'm super excited about our sort of the breadth of topics that we have this year. And we have some really amazing speakers, and so Lorelei is going to kick it off for us, and I'll turn it over to her.
Thank you. Hi everybody, can you hear me?
Yeah.
Perfect. Okay, so my name is Lorelei. I'm here. I'm a certified equine massage practitioner, which is you see up there. I'm also the founder and owner of Unbridled Healing Equine Massage Therapy, which is a fairly new company because I am new to this world. So thank you all for having me. I did want to start with qualifications for equine massage therapy, so you know kind of who to trust in this world. There are no requirements in the state of Texas for licensing, so just keep that in mind. When you call somebody to come out and work on your horse, please do your research and know who's coming out to work on your horse, because you can mess them up. So, kind of a breakdown of the schooling, it ranges from about 3 to 5 day courses that kind of pop up all over the state to a 500-hour course, which is what I did, and you can see the School of Applied Therapy, that is my certification there. Additionally, I wanted to touch on biomechanics taping because it is a fairly new concept in the world, not really many people know about it. This is a very rigorous and intense modality. Rebecca Haddock actually put on this course, and it's the only one like it for the equine world. But this focuses more on ligaments, bones, tendons, and things of that nature through a specific kind of taping. So that's that. What is equine massage therapy? I figured y'all would want to know. So this is a modality that focuses on massage therapy like most of us would go and have done. For me personally, the scope of my practice, I like to focus on sports performance management and mobility. So that's what I plan to talk about today. I know some people focus on energy work. That is not me. But I just wanted to summarize here. Swedish massage techniques, that's your basic, the word I'm looking for is strokes, which is a weird word, but bear with me. Your myofascial release, this is a big one, and I will touch on this a little bit later. Acupressure, manual lymph drainage. I do a lot of kinesiology taping in my practice. Big fan. Stretching, and then you obviously have machine-based therapies like your red light, EMF, your Equivibe, things of that nature. When I come to a client and I start with a horse, I always like to see them move. So I'll do an evaluation of kinesiology and biomechanics. And then the sessions that I do range from about 1 to 2 hours, depending on your horse's tolerance, your horse's needs, things like that. And then frequency, this is a great question that I get all the time. Depends on your horse. This can be my answer for a lot of things. So starting out, I like to say twice a week, 1 to 2 times a week. Your horse is new to this, and then every 4 to 6 weeks for maintenance after that, especially for your athletes, those of y'all that compete, ropers, barrel racing, English, anybody like that. So I always tell people, veterinarians are your best friend. Please have your horse evaluated. So biomechanics taping, this is something I'm just briefly touching on, so I won't go over everything on this slide, but that taping is actually, I don't even know if you can see that, that's pulled directly off of the biomechanics course that I'm working on, and that is a tape to prevent hyperextension of the carpus or the front knee. So this is, like I said, a look at bone, ligaments, tendons, things of that nature. I like to use this when you have horses that are competing and we're trying to prevent an injury, so your ropers, your barrel racers, things like that nature. Posture correction, this is used a lot of times in foals that have either scoliosis or angular limb deformity, things of that nature. This, I will not read all of this because I don't like reading off slides, but this is directly from my course. So if you guys have questions about biomechanics taping and what it is, I am taking case studies for my school. So if you want to know more about this, let me know, find me afterwards, and I can email you this PowerPoint. This is one of my client's horses. This is a good look at pigeon toe in that front left leg. He is, I want to say 12 years old. He's had this basically his whole life. This is the before and after with taping. So a lot of people will say, well, why would you just change that hoof angle and that leg angle and leave them be? Because you can cause other issues. I focus on the entire body and how fixing this issue is going to affect other parts of the body. So, okay, back into massage therapy. So I did 2 different categories here. There's a reduces and improves category, just because it's easier to read. But for our reduces category, and I have sources at the end of this if you guys want to read any of these papers or studies done, let me know. But muscle tension, cramping, spasms, recovery time's a really big one, especially for my athletes that are performing. We always like to see a decrease in recovery time and soreness. Risk of injury, another big one, especially if you guys are competing. If anyone has a high dollar horse and they're injured, you know how much that's tragic. Reduces your pain, stress, whether it be physical or mental. I focus on physical, but mental is also an aspect. Swelling is a big one. It's dependent on infections. If we have infection, I don't like to work on your horse. But if it's injury related and the vet has cleared it, we're good to go. Why I have hindered movement in all caps is because this is the point of my focus when we're reducing things. I like to see better movement. If you've got a horse that just ran full competition, say we're a head horse, we're team roping, and we really dug into the ground to pull that calf and our back end and our front end are really tight, they might have a harder time walking after that. So on our improved side, circulation's a big one. This is blood flow and lymphatics. Your mobility and proprioception. Proprioception I put in here, that's basically a fancy word to say, are we aware of where our feet are? My horses that have EPM, this is a big one. You can actually influence nerve function through massage therapy and help them find their feet. Immune function, overall healing, nerve function like I just stated. Your internal systemic function, this is a big one, so your internal structures, organs, things of that nature. Rehabilitation, and then performance in all caps because that's what I put. So long-term benefits, a lot of these are listed on the previous slide, but I have two that I starred because they're really important in my opinion. Our maintaining of movement for functionality in older horses. This is a big deal. So this picture on this slide, the flea bitten gray horse, that's a head horse. This is a client of mine, the horse turns 25 in April, and he's still competing. This was taken on Sunday at the Brazos Expo Center. So this owner has put in a ton of time, a ton of effort. They do massage therapy techniques themselves at home. They have me come out. They use fancy machines that the rest of us probably can't afford. They do red light therapy. They have their whole training schedule. But this is just to prove that you can still do this with a 25-year-old horse if you take care of them. And then the second one I have starred is your posture improvements, including gait. So this is kind of what I stated a few minutes ago. If you have a horse that's really tight behind end, we need to improve our gait. So if we need to improve the reach of the front end, something like that, this is a big deal. So I included this slide because I get this question a lot. Discipline affects the body, and also your rider biomechanics affect the body. So the way you move under saddle affects your horse, and your horse's job affects your horse. So I put on the left side just 4 of the top most competed in Western disciplines, and then on the right side I did English. I'm not going to read all of this, but a lot of these kind of overlap, but you'll see especially like with your barrel horse versus your hunter jumper, your barrel horse is typically going to have core issues, stifle issues, and sometimes even front end issues just for the fast movement that they do. And then your hunter jumper, they probably have a lot of lower back stress because they're jumping and landing really hard, and they probably have some stress on their front end legs as well. So these are a couple of pictures I've taken. Ironically, most of the pictures I have are of Arabian horses, but I work most on quarter horses. So the left picture is an Arabian horse. I took this picture back in December. It was a client I went to go see. And this was just kind of a, hey, my horse is old, can you help her feel better situation. But I looked at her and was like, these are perfect pictures. So on the first left side, I drew on these, I don't know if y'all can see the black line, but basically what I drew here is you're looking at her point of shoulder and that bottom line, it's a little uneven, and then just above that where her neck feeds into her body is also a little slanted and uneven. And then looking at her neck comes out kind of at a curve from her chest. This is really common in Arabians because they have daddy long legs and they graze like this. So I see this all the time in Arabians. This is after just 90 minutes of massage therapy, the difference you can see in your horse, so just keep that in mind. On the right side, this is also an Arabian. He was 6 years old, and boy was he a mess. Personality-wise, just a mess. So in that first picture of him, you can see it looks like I'm yanking his head to the side of the picture, but this is just how he stood square. So he obviously had some issues going on. I would have loved to get a chiropractor out for him. But as you can see between the first and second picture, we got his neck straighter coming out of his head, and we also fixed some of that shoulder tension. There's this muscle that sits right in between the neck and the shoulder called the subclavian, which is crazy because horses don't have a clavicle or a collarbone like we do. But that muscle takes a lot of torque and tension. It's responsible for movement of the head and also of the leg. So if you've got issues like this, as you can see in these pictures where it's uneven, your horse is probably going to have a hard time moving. And then 2 more pictures. The first one here, this Blue Road's a quarter horse client of mine. We actually just discovered that she has a fractured scapula. So that's what that bump is there. It was from a gelding that mounted her and it just fractured her arm, her scapula, shoulder blade. But as you can see, it's really hard to see here, but she has like a patch of swelling going on near that that shoulder, and then her neck had some curvature issues, and her chest wasn't really defined, and you can see everything's just kind of balled up and short. And then on the after picture, this was about maybe 2 hours later, and I like to walk them around, so that's why the scenery is different in these pictures. But you can see the swelling in that shoulder's gone, and then her chest looks more defined and elongated, as well as her neck. And then this last picture, another Arabian that I worked on, this was actually before I got my license, but really the main difference is her skin coat. So this is not sweat, this is not show sheen, this is not anything like that. This is just before and after massage therapy, the things you can see in the coat that change. So fascia, this is a huge thing that I deal with. This is probably my arch nemesis in massage therapy. For those of you that skin deer, I have a picture in here, so just wait. But fascia is basically collagen connective tissue that outlines everything in the body, from muscles to organs, bones, you name it. This stuff can get stuck, and when it gets stuck, you've got pain and inflammation, other problems all throughout the body. But its main job is to provide structure and stability. So it's kind of what helps hold us together. Like I said, highly overlooked and ignored. So when you have restrictions with fascia, things that you might see or symptoms you might see, reduced mobility, which is pretty much a symptom for everything. Overcompensation, so if you've got a fascia knot on this side of the body, you're gonna see issues here, which is why I built this thing. This is called a tensegrity model, and it's really cool, I don't know if y'all can see this, but imagine that the straws are the bones and the rubber bands are the ligaments, tendons, fascia, all that stuff in the body. If you've got a fascia knot that pulls this way, it affects every other part of the body. So that was just a little visual I wanted to show you guys. And I can pass this around if y'all are interested. Discomfort, pain, and inflammation, that's a big one. You might see like bubbles or knots throughout the body. Your decreased circulation, because fascia plays a big role in that, and hydration. Your risk risk increases, and then you might also see decreased coordination sometimes. So, what might cause restrictions with your fascia? Stall rest. This is a huge one. I had a client whose horse tore every ligament in her knee, including her meniscus, which is a ligament, but she tore everything in that knee. Had surgery over at A&M and was on stall rest for probably 4 to 6 months. It was a long time on stall rest. So I worked on this horse, and her entire body just felt like one stuck sheet of fascia. It was awful, but she moved really well after. So repetition of specific movements. I'm calling y'all out, those of y'all that use spurs. This is a big deal. I'm not one way or the other, but just know that if you spur your horse pretty frequently in the same spot, you can cause micro tears and abrasions within that fascia and that muscle, and that makes it harder for them to use that muscle and use their back. And then you get things like kissing spine and atrophy and whatnot. Injuries and scar tissue, so kind of back to the spur thing, if you've got scar tissue in the body. Consistent tension or stress of a specific area that kind of goes back to the repetition of movements. Improper biomechanics or posture. I had a client whose horse was morbidly obese, and it wasn't even his fault, he just had a metabolic issue, but he had sway back so bad at 10 years old, and he just was never taught how to use his back muscles, so we had to work on that. But that stress adds to different areas of the body, like the front end and behind end. Aging, this is a big one. Wrinkles, anybody? We have decrease in collagen production when we get older, so if you have an older horse, they might have problems there. And then vitamins and minerals, nutrition is going to apply to everything and anything. It's a big deal. So this next slide has images of a pig carcass that we slaughtered a few months ago. I make dog food out of it, so if anybody's squeamish, please look away. This is what fascia is. So it's that web of silvery hue stuff that outlines the muscles. And then the picture on the right with my finger, this was just so that you guys could see how it deflates. I had a video, but it won't work, but it has give to it. It's very interesting. So moving on to considerations, disease is a big one. Like I said earlier, if your horse is sick, has some kind of viral or bacterial infection, please have a vet come evaluate, because if I work on that horse while they're sick, it can make it worse. They have lymph nodes in the body, and those lymph nodes are responsible for activating the immune system, and they target specific areas in the body, specific viruses, and if you activate that entire system, you're spreading out that lymph fluid, and they can't target the viruses. So just keep that in mind. Disorders, if you guys have Cushing's or PPID horses, or somebody with an EPM horse, which is very common in this area, just things to consider. Injury, so the image on this slide is one of our mares out at the ranch. We sent her to training, and when she came back, our gelding decided they weren't friends anymore. So he her all over the pasture, and you can see her left hock kind of blew up like a balloon. So I did some massage therapy and manual lymph drainage, and within the next day, I mean, the swelling was gone. So it's pretty powerful stuff. Chronic issues. One of my clients has a chronic pastern issue, and we have no idea why. Like $100,000 diagnostics, MRIs, you name it, we still don't know why. So it's just a maintenance thing. Imaging, huge, especially for my biomechanics people. If you have x-rays that are interpreted by the vet, let me know. Blood work's a big deal. Surgical procedures, if your horse had kissing spine surgery, we're trying to rehab, massage therapy can be beneficial. Environment and living conditions, I put this on here because I do a ton of kinesiology taping, and pasture horses love to rip it off. So things like that. Diet, another big one, and then your rehab and physical therapy. This is a huge area of my scope of practice. I'm always giving people PT and homework, things to do at home. So moving forward, physical therapy, we just talked about that. If you've got a horse with a weak back or a core issue, Equiband is one of my favorite things to use. It's this system that hooks around their hind end and kind of looks like a saddle all in one, and it helps them engage their back and build that back muscle. Another big one that might upset some of y'all, be aware of how you ride your horse, please. Because if you have improper mechanics, your horse is going to take a beating. If you're loping and you lean way back and your weight is on that lumbar spine instead of the thoracic spine, that can cause a lot of issues. I know we have a saddle fitter here. I'm really excited for that presentation. Your saddle fit is off. Really big deal. Educate yourself. Nutritional factors, hoof factors. Talk to your farrier, talk to your vet. Chiropractic evaluations of your horse. I will always recommend these. I swear by them. Love working in conjunction with vets and chiros. They are very knowledgeable. Kinesiology taping, this is something you guys can actually learn and do at home. So I oftentimes will teach owners how to do a specific tape. If we know we're going to reuse it, say it's to help activate muscle while we're in work, I just tell owners how to do it and they do it at home. And then the very expensive stuff, red light therapy, Beamer, Equivibe, those of you that are into PEMF, all very expensive but great. Biosphere Equine Anatomy app, those of you all that really like studying your horse, this is a huge, fantastic app that shows a breakdown of the body, the different systems within the body. You can hone in on one thing versus another. So I like it, I use it all the time. And then I like to send y'all home with something that you can do starting now or tomorrow morning, because we're probably not going back to barn tonight. Myofascial release. Y'all can learn this online, it's pretty simple. Or if you're curious, come find me, I'll show you how to do it, since we have a wonderful model here. And then this is the second point here. I give this out all the time, especially for people that have rope horses, their backs tend to be really tight. Just a gentle, like light pressure movement of your hand down their back can really warm up that muscle before and after working, but I really emphasize to do it after because it can help dissipate lactic acid. So. And then obviously your flexing of the head, this is one of my favorite things to do because it helps mobility, but you can also see where your horse has weak points. So we flex the head to the side and we also flex the head down. You can even flex up if your horse is good at it. Sometimes you'll hear popping and see weird things, but like I said, this is a great one to help keep them flexible and mobile. So these are sources if y'all have any questions. ChatGPT is also great for finding scientific papers, by the way. And then, yeah, so that's all I have. If y'all have any questions, come find me, let me know. Does anybody have anything now they can think of? Anybody? What's up?
Do you work on horses with EPM?
I do, but I like to have a vet evaluation first. So if the vet's cleared them, we're good to go. I do. I've got one right now out near kind of the Waco area, and her horse had EPM something fierce, and she wanted me to come out, and we got a panel done. She came back positive. The vet did some red light therapy. We were good to go, and it helped her because it was in her front end. That shoulder was very wobbly, so we got her back on track. Anybody else? Yes.
When you're talking about doing the KT tape, what type of tape do you use on the horses? Because I know you can buy them on the different sizes for people. What type do you use?
Yeah, so you can honestly find different tapes that work. I've even found different colors of specific brands work. I'm a big fan of Equitape just because I'm doing education with them and it has not failed me. It's not very expensive. I think you can get it for maybe $16, $15 a roll. And that's actually my affiliate link there. So if you guys want this, you can click it and it'll take you to the website. But I use Equitape. I also use dynamic tape if I'm working with biomechanics. That's a biomechanic tape that works with bone, ligaments, tendons. I don't use it for kinesiology purposes. But OK Tape's another good brand, but I usually stick with Equitape.
Yeah. Thank you.
You have to show
tape specifically, you're utilizing the hair to your advantage almost, so you kind of have to like back the tape into the hair. But I have pictures if y'all are curious later. Did you have a question?
I wondered how massage therapy would help with an arthritic horse or horse that has issues with arthritis.
Yeah, that's a great
An
question.
older horse, you know.
Yeah, so I actually have a lot of clients that have arthritic type horses, and we kind of look at that slide. Where is it? So this slide I love, but things with arthritis, we're looking at improving our circulation in that area. Arthritis is one of those things you're not gonna fix, but you can slow down the process of it depending on what kind of vet care you put into it. Especially with dogs, I was a vet tech for a long time, we had all kinds of injections. I think, did they use Adequan for horses? I think originally, yeah, okay. So things like that, but for specific massage therapy, I'm looking at nerve function, I'm looking at circulation, I'm looking at the surrounding muscles and mobility of that horse. If we can keep them in shape, if we can keep those muscles toned, typically it helps take pressure off of that arthritic area. Anybody else? Y'all have good questions.
Thank you so much.
Perfect. Thank you guys.